Welcome to the Health Wealth Podcast and Radio Show with Forbes author and contributor Dr. Josh Luke, America's Healthcare Affordability Authority. Visit drjoshluke.com for information on speaking appearances and other resources.
It's Dr. Josh Luke here with the Health Wealth Podcast, and this is actually episode 1 of what we're calling our Health Wealth Basics series. So welcome again to the Health Wealth Podcast with Dr. Josh Luke, where we're all about teaching American businesses and families how to make healthcare more affordable, how to reduce spending on healthcare. And we're going to start and launch this podcast with a series we're calling Health Wealth Basics. And it's going to be 5 or 6 episodes where we just talk about basic terms and kind of concepts in healthcare, in consuming healthcare for businesses and consumers that are important for you to know. And the most important one, really, and the reason we're going to start with it, is called consumer-driven healthcare. And consumer-driven healthcare is simple. It's about taking ownership of the process. It's about becoming what I call an EHC, an engaged healthcare consumer. Now, engaged healthcare consumers, the easiest way to compare it is to think about when you buy a car or a home. You engage in the process. You price shop. You quality compare. You find out where the best value is and where the best fit is. And that is often the selection you make. In America, we often haven't done that. And the reason is because Gen Xers and Boomers grew up in an environment where commercial health insurance took care of most of the problem, right? They paid for everything. There was often a small copay, less than $50, less than $100 even sometimes for a procedure at the hospital. And so it was easy for us to say, oh, I'll just go to the best hospital. I'm not worried about how much they're going to charge my employer or if my deductible's a little more because it's still negligible. Well, those days have come and gone, and hyperinflating healthcare costs in America are bankrupting American businesses and families. So Health Wealth is about giving you the tools and engaging in the discussion to overcome this hyperinflation and to bend that curve backwards. So not only are you not getting a 15% increase every year for your business and your healthcare cost, but you're actually bending the curve backwards and reducing spending and improving care at the same time. So to talk a little bit further about consumer-driven healthcare, I want to give you an example. And this is right out of my book, Health Wealth: Is Healthcare Bankrupting Your Business? 9 Steps to Financial Recovery, from Forbes Books. It's actually the intro to the consumer-driven healthcare chapter. And it's about, let's say hypothetically, it's your daughter's 16th birthday. So you and your spouse jump in the car, and the daughter's so proud, so happy. She's printed out the exact car that she wants to get off of the internet, down to the detail, knows the color, knows the price, knows everything about it. She's been researching it for months, of course, right? And it's a proud parental moment for you and the spouse to jump in the car, head down to Auto Center Drive. You come to the stoplight on Auto Center Drive, and as you're at the stoplight, she looks out the window to the left and she sees it. There it is, the exact car she wants, down to the exact detail, exact color she wants, right? It's in white, the color she wants. So she says, Mom, Dad, there it is, right there, $16,000. And then all of a sudden, Mom says, hey, look to the right, look on the other side of the street. It's the exact same car also from a different dealership, down to the exact detail, color white again. There's only one difference. The sticker on the window says $42,000. So here's my question for you today. Which way are you going to turn, left or right? And I think I just gave you a pretty good example of how traditionally with American health insurance, we probably would have just turned right and paid more for that same exact car because we perceived that it was better and because it was somebody else's money. And herein lies the problem, right? If it's our money, nobody even hesitates. We take a left at that stoplight and we go to the salesperson at the lot where it says $16,000 for the exact same car on the other side of the street and say, hey, tell me the difference between this car and that one. And he or she kind of smirks and says there really is only one difference, and that's the price. Well, welcome to the world of American healthcare and the lack of transparency when it comes to hospital pricing and physician pricing. In what other business in America are you unable to get the cost of goods before you consume them? And it's amazing, having been a hospital CEO for 10 years, and I think of all the faces of my staff. If you'd walked in the front of my hospital the day of your procedure and done all the paperwork and asked how much it was going to cost, A, my folks didn't have the prices. B, I didn't want them to have the prices. C, if you would have known the price, you would have been alarmed. But D, when you price compared our cost to the hospital across the street, you might have seen a 60% difference. Not just for you, but for your employer. So what we're learning in consumer-driven healthcare is if you engage in the process, you can save yourself significant dollars as well as your employer. And let me give you an example to finish up on that car dealership example. There's often hospitals on opposite sides of the streets that do the same procedure for a 60% different rate to your employer when they're self-insured, right? We're going to talk about self-insured in our other health wealth basics, where we're going to talk about different terms to make sure you understand. But for now, just to understand that your employer actually pays the part that you don't when you're self-insured. So if you go to a hospital on the left side of the street, your employer might only pay $10,000 for your procedure. On the right side of the street, they could pay $60,000. That's not an exaggeration. It happens often. So I want to give you a little pointer. Let's say your deductible is $100 for the procedure on the left side of the street and $500 on the right side of the street. You're going to pay a little more if you want to go to that other facility because they're not in your narrow network, or they're not what we call a center of value or a center of excellence. But here's the cool thing, and here's a great tip for you. If you actually went to your employer before that procedure and said, hey, if I decide to go to the center of value or the center of excellence within our narrow network, another term we'll cover later, okay, are you as my employer willing to pay my copay? And you might go, why would they do that? Well, I think if you step back and look at it, here's why. You might be paying only $400 extra as a copayment, but they might be paying $40,000 more. So for you to go and say, hey, would you be willing to pay my copay if I go on this side of the street as opposed to the other? Oftentimes the answer is going to be yes. So there's a tip for you, if not several on today's episode. There's one tip for sure for you to go to your employer next time you have a major procedure, even a minor procedure at times, and say, hey, what is the difference in cost to you as the employer if I go to the center of value versus the other hospital? Because guys, oftentimes, let's be realistic, the center of value is not oftentimes the big shiny hospital by the beach or in the center of town that has a new tower every year or two and is named after some donor. Those hospitals often aren't giving you the best discount because they don't have to, because everybody wants to go there. But when you do a little research and study, you know what you find? The quality scores at the hospital on the other side of the street are just as good, sometimes better. And guess what else? Often the doctors are the same exact doctor. So these are the type of things to keep in mind as you engage in consumer-driven healthcare. So really this concept of consumer-driven healthcare it's just exciting to me, because it's about America engaging in the healthcare process, just as you would when you buy a home or a house. And there's so many other ways to engage in the process. You know what most Americans know as consumer-driven healthcare? They know it as a high deductible plan. So let's talk about that, because that usually invokes some negative energy. A high deductible plan, most employees, if you're an employee, you might perceive that when you were given a high deductible plan, they were shifting costs to you, and that could be true. It usually is true a little bit. But guess what? If you engage in the process, if you become an engaged healthcare consumer, that EHC we talked about, then you could actually save money in a high deductible plan. You could save money because the example I just gave you is a great example of how instead of traditionally paying $500 for a procedure at the big hospital that you want to go to because it's shiny and the advertising tells you it's better, or you see their name on the banner at the ballpark every time you go, you can go to the center of value across the street that actually the data shows is better quality. A little known fact that there is very little research in healthcare to prove that quality has any relationship to price. In fact, the only body of work that exists to date is a small body of research that shows that it might actually be the opposite. The hospitals and doctors that are engaging and talking to consumers and being transparent with them often engage in the quality process as well, and so the quality is often better when the price is less. Imagine that. Interesting stuff. So the high deductible plan isn't always cost shifting, but it will be if you don't engage as an engaged healthcare consumer and engage in consumer-driven healthcare. Let me give you one more example of consumer-driven healthcare. You oftentimes hear the term medical tourism, and we're going to have a whole episode on medical tourism later. But let's talk about medical tourism, because you're right now thinking, oh, Josh, I don't want to go to Costa Rica. I don't want to go to India to have a procedure done, even if my company pays for all expenses first-class trip for a week, right? Well, where medical tourism is making a difference is from your county to the next. And let me give you an example of Santa Barbara, California. In Santa Barbara, California, the county itself is taking its orthopedic procedures 3 counties to the south, 3 hours to the south if you're driving a car, because they're saving so much money. And that's the county telling hospitals and health systems within their county, I'm sorry, you're so expensive. We have to take our business elsewhere. And guess what? Think about that from a capitalist perspective. The health system lets them go. They're like, times are good for us. We don't need that business. Now, after it's gone, I'm sure they're going to feel it and they're going to fight for it back. But that's the disparity. So guess what happens if you're an employee of the County of Santa Barbara? You get a 5-day all expenses paid trip to a very nice resort in San Diego County. You get your procedure done at one of the highest rated hospitals in the country. You get to stay for 3 or 4 days after to make sure your follow-up and rehab plan is very clearly communicated and it's started effectively. And everyone seems to be happy. Now, you don't have to pick that, but you're going to pay a lot more if you don't. This is engaging in the healthcare process, not just the consumer, but the employer. So it's very important that when your employer, when your company engages in the healthcare process, that you as employees do as well. So this is really the concept I wanted to share with you about consumer-driven healthcare and medical tourism. And sometimes you driving an extra 60 or 90 minutes to a different county or to a different hospital is really going to pay big dividends for you. So consumer-driven healthcare, there's a whole chapter on it in my book, Health Wealth, Is Healthcare Bankrupting Your Business? 9 Steps to Financial Recovery. Learn more about it. Follow me on LinkedIn if you don't already at Dr. Josh Luke, and check out all of the resources we have for you to reduce your healthcare spending by 30 to 50% at health-wealth.com. That's all for this episode of the Health Wealth Podcast with Dr. Josh Luke.
Thanks for tuning in to this episode of the Health Wealth Podcast and Radio Show with Forbes author and contributor Dr. Josh Luke, America's Healthcare Affordability Authority. Visit drjoshluke.com for information on speaking appearances and other resources.